to have, we have a great opportunity to have some mental health providers over the next couple Wednesdays to help us navigate these challenging times that we're in. Our first presenter is Shelley Dixon. She found her passion for wanting to work with children and families from her late grandmother, who fostered children for many years. In addition to many of her life influencers being members of the educational system. Shelley obtained her undergraduate degree in psychology from Cheney University and her first graduate degree from Springfield College in community psychology. Soon after, Shelley decided to go back to school to obtain a second master's in criminal justice and an ABA SAT.
Can I just quickly intersect? Can everybody who is not talking or presenting just mute themselves, please? Because there's a lot of background noise coming in.
Thank you. Shelley began her career in behavioral health field, providing individual, group, and family therapy throughout the Philadelphia County area. Shelley has also worked in preventive programs for the School District of Philadelphia, providing case management for high school parenting teens, at-risk youths, and children as young as 3 months old. Shelley has provided her support, knowledge, and advocacy for families for well over 20 plus years. Shelley joined Aldersgate Youth Services Agency in August of 2021, following a devastating loss of employment due to COVID-19 pandemic. She has been up at the high school and at the middle school and has provided many services as a SAP liaison, supporting individual students who are eager to improve their school experiences. So with great appreciation for Shelley's experience and dedication to mental health, tonight's introduction presentation is the sign of depression. Thank you, Shelley, if you want to begin.
Hello and good evening, everyone. Thanks for joining this evening. When the opportunity was presented to me through Aldersgate to do the following presentation, I was really excited about wanting to do this topic, just because I truly believe that this is a topic that we should be discussing, and having a platform to have what I want to say a real conversation is extremely important at this day and time. I just think that the pandemic was what I consider a trigger for a conversation that should have been had many years ago. But we do know that the pandemic was definitely an eye-opener for a lot of us as parents and as educators. So mental health in children and depression is a passion for me and always has been. That's why I studied psychology in undergrad, and my grandmother being a significant influence in my life was definitely something that I wanted to explore. We had many children. My grandmother fostered many children for many years throughout my college years, and I just could not really understand how someone is such as adult could hurt children in such a way, that would pretty much destroy them maybe for the rest of their lives. I just had to understand why those types of things took place. So what I would like to do is have an open conversation about what warning signs to look out for, and to also talk about depression in children, because that is where it starts. So I named my presentation, "Is My Child Just Going Through a Phase?"
Here.
So because Dr. McCluskey already went through my background a little bit, I'm going to skip the first slide. This is basically what she has already stated about my background. So throughout this evening, I would like to just touch bases on an array of topics. just starting with what is mental health? What are the warning signs? Is it a phase or am I in denial? Which parents will ask themselves repeatedly over and over again. What are the symptoms of mental health and depression in children? What is the truth about mental health? Some facts, true facts about what mental health is and how it's developed in children. Safety planning. So once you acknowledge that your child needs supportive services, what do you do from there? How can you keep them safe and keep everyone safe? School involvement. That is when you begin to know that your child needs supportive help outside of the home, maybe within a community, and definitely school. Therapy and treatment. Why are those things important? Prevention and intervention. How can you help the children through these tough times? Insurance is a huge barrier to why a lot of families do not seek mental health services, because it is definitely a challenge. So we'll definitely talk about that. Resources and parent tools, giving parent the tools to know what to do and how to seek help. Also self-care. While your child is needing support, parents need support too, guardians need support. This is just not an individual type of situation. Mental health affects everyone that's involved with that child. So we'll talk about those things as well. So what is mental health? So we have to begin to discuss what is mental health. We hear a lot of things, we see a lot of things on television. We do a lot of research on the internet. And the first thing that is very important is having that uncomfortable conversation with yourself. When you begin to see changes in your children, you definitely want to believe that something is going on. The initial, I think, thought a lot of times is, am I just seeing things? You know, what's going on with my child? Maybe, especially with the pandemic, children were home all the time. There possibly could be a lack in scheduling, sleep patterns were off. It just was a very difficult time. So you may not initially know something is happening. So over here to the right of the title, I have quotes that I've heard over the years working with parents, and myself being a parent with a teenage daughter that has started high school, that also struggled during the pandemic. So this is a real conversation. So the quote says, "Not my child. They have never experienced anything traumatic. So my child definitely can't have anything as far as mental health challenges," which is not true. So mental health includes our emotional, psychological, and social well-being. I'm sorry, I can't see my entire screen. So it says mental health includes how we feel and how we act. It also helps determine how we handle stress and make decisions and choices. Mental health is important at every stage of life: childhood, adolescence, and throughout adulthood. So pretty much mental health affects us all in some capacity. And it starts, I want to say, in the womb. And why I say that mental health can start in the womb with a child, because if a mother is experiencing any type of trauma, that could be domestic abuse, it could be drug addiction or abuse, it could be alcohol abuse. At some point, when that child is born, it will affect that child in some way. So mental health just doesn't begin at adolescence. Throughout me learning about psychology, I would hear that mental health in children didn't start until maybe around the age of 8. That is not true at all. It starts very, very early. So initial signs that you want to see or that you may see in your children, where you should start to really ask questions and really pay attention, is when you see the following list of warning signs. So here the quote on the side is, am I seeing things like, is this real? Am I actually see my child struggle in a way that I never have before? So initial warning signs that you want to pay attention to is impaired performance in schoolwork. So if your child is a child that loves school, enjoys school, and then generally gets good grades, but then you begin to see a decline in completing homework, academic tasks, and then there may be a decline over the second and third quarter of receiving their grades. So the first quarter, they can start out with A's and B's. Perfect. Everyone's happy, the child is happy, but then there could be a shift. And the second report, you start to see a decline. Maybe their grades may go down to a couple of C's. Then you may start to say, well, what's going on? A child may say, well, I'm having a hard time turning in work, but it may be very simple, but it's something to look out for. Poor hygiene. You may see a decline in children wanting to wash up and clean up and maybe brush their teeth, comb their hair. You'll definitely see the hygiene decline. That is one of the number one symptoms that you'll see in the beginning. Increased sleeping, always wanting to sleeping for maybe over 9 hours, starting to be tardy for school, increased sleeping on the weekends when they're usually up and active. You'll start to see increase in sleeping. Unable to complete simple tasks, simple things like picking things up off the floor in their bedrooms after dinner, not cleaning up after themselves. And of course, at this point, I'm talking about maybe children around the age of 10. Younger children, you'll see maybe more hyperactivity behaviors, the lack of listening, maybe some defiance. You'll also see refusal or difficulty expressing how they are feeling. So maybe asking your child, how are you? Are you okay today? How was school? And they either don't want to talk to you at all, or it's very, aggressive.
How many more? 3?
I don't want to talk. I don't want to talk about my day. So refusing to talk to you. Refusing to come out of the bedroom. You'll see this a lot as well. Children, because they want to avoid others in the home. So they'll stay in one particular area, sometimes the bedroom, the bathroom as well. I have seen an increase in children in wanting to sit in the bathroom for hours and not want to interact and engage. Avoids interactions with family members in the home. So not maybe interacting with siblings, not interacting with animals. If you have animals in the home that your child is connected to, not wanting to be, want to play with the animals, not wanting to talk to their parents or guardians. Persistent boredom, always speaking of, I'm bored, I have nothing to do. When usually they're active in the home, they have board games, they may like art, they may like video games, but constantly speak of boredom. Increasingly agitated, this may increase over time. That's just avoidance behavior, not listening, not following through with tasks, and just declining and demanding things. Frequent physical complaints like headaches and stomach aches. I have seen this over the course of time at school when children are full of anxiety. They can't pinpoint where to seek support, or they are just pretty much scared to ask someone for help. They will complain of headaches and stomachs, ask to go to the bathroom multiple times or go to the nurse. Sometimes that is so they can hide, so they can escape from others and that's around them. And I don't know how stomach aches. I'm sorry for the misspelling. More risk-taking behaviors or showing less concern in their own. I can't see what I have written over there, but risk-taking type of behaviors, doing things that they normally or typically would not do, that may put themselves in danger. You will also see an increase in not telling the truth and not being honest. So these are some more symptoms. So some of the symptoms here, they range over across of different ages. So in younger children, you'll see crying more, an increase in tantruming, falling out, whether you're in the home, whether you're outside, shopping. You've seen that a lot of times in children that will just have a lot of tantrums no matter where they are. Increased sensitivity to criticism or negative experiences. Everything is negative around them. They can't see the positive in things that they're doing or things that they are involved in. Irritable mood, definitely. You will see changes in the mood depending on how they are feeling, how they are engaging with others. Eating, you can see children eat more. It is a part of obesity, or even eating less. Sleep patterns is a huge symptom for children with depression. Sleeping can be anywhere from 9 hours up to 14 hours or more. What you'll also see with sleeping, they will sleep during the day and will be up throughout the night. And it can change, but I've seen that a lot. Sleeping during the day and up at night, late hours. Increase or decrease in weight change, as I said. Social withdrawal. So if your child is generally someone that's an outgoing kid, has a lot of friends, you'll see that social withdrawal, not wanting to do things that they typically do, like maybe play sports. If they're involved in activities like soccer or dance on the weekends, those things may just stop or decrease over time. In younger children, clinginess, clinging to parents, not wanting to go with others or go out to have fun because they're so afraid they may not see their parents again. That's where anxiety and depression kind of meet. Just being fearful, overly pessimistic, feeling hopeless, no one likes me, no one wants to be around me, those types of feelings children will begin to express. Expressing thoughts of harm themselves or others around them. Your more serious symptoms will be self-injury, cutting themselves, starting fires, reckless behavior, like doing things. I've seen children jump down concrete steps or jump off, just all kinds of dangerous behaviors. Young children may act younger, tantruming, but they may be at the age of where they should pretty much know that is not how they handle things. So you'll see an increase in things and decrease in other behaviors. So here I'm going to talk about the truth about mental health. These behaviors will eventually go away. It's just a rough time. These are some things, that's another quote that a parent may say to themselves. It's just a rough patch. We're going through a lot right now. It's a pandemic. These behaviors will go away once the pandemic is over. That's not necessarily true. Sometimes the following behaviors or feelings of depression and anxiety could have started years prior to the pandemic, and children aren't always, or know how to express themselves and express how they are feeling. So I'm just going to go over some points. I just want to stop for a second to see if anyone has any questions so far, or about any of the slides, or no questions just yet? Okay. So the first bullet, clinically significant depression is being severe enough to interfere with the ability to function. So depression in children is one of those behavioral diagnoses that your ability to function is extremely difficult, where a parent or an adult interacting with a child with depression, it may come off as defiance. This can be extremely frustrating, and that definitely should be put out there, that parents, when these behaviors start to kind of develop and they start to show, for a parent, it is very and extremely frustrating, because you're not typically used to seeing your child act in that manner. So also, it's quite common at every age. It also affects 16% of children in the United States at some time in their lives, and it's thought to be increased in adolescents across the country. So regardless if we're in a pandemic or not, children suffer from mental illness, and sometimes they have no idea why they feel this way. It could be due to a traumatic event or not. It could be the environment in which they live in. It could be maybe being bullied at school. It could also just be a self-image. It could be a number of things. Other statistics about depression include its tendency to occur at a rate of 2% prior to teenage years and approximately 5 to 8%. So in adolescents and children younger than adolescents are considered. Prior to me working for Aldersgate, I was a behavioral consultant for a child care center. So that's why I was saying it's very important to know that sometimes mental health begins in the womb, before children are born. So as early as 2 years old, I did assessments on children where children began to receive services at 2 years old and older, which seems like it's unheard of, but definitely it's not. It starts as young as 2 years old. Also, it could be the leading cause of health impairment and also death. In addition to 3,000 adolescents and young adults die by suicide within the United States, making it the third leading cause of death in people ages 10 to 24 years old.
Shelley, can I just interrupt for 1 second?
Sure.
I just want to let anybody know, if they want to put their questions in the chat, I can monitor the chat box. If a question comes up, I can ask it at that time or when you're finished.
Okay. Thank you. So safety planning is something that you definitely want to do once you start to see the behaviors in your children start to shift. So the quote for this slide is, "What can I do to help my child?" Your child needs you. So parents, what you want to do is, when your children's behaviors start to change, and if you notice a change, please pay attention. Behaviors just don't go away. If you are not aware of maybe a traumatic event that has taken place, you want to start to pay close attention and start to have conversations with your children about what they may be feeling. So here I have a list of things which you can do to safety plan. And the first bullet is, family members and friends should seek mental health assessments and treatment for depressed children. How you can seek assessments is definitely reaching out to your child's primary care physician first. If your child does not have a primary care physician, what you could do is reach out to your child's school. School is a big part in supporting you and helping your child. This may be a family that may be currently without health insurance. During the pandemic, a lot of families lost jobs, lost their employment, which meant losing maybe their health insurance. So reaching out to your school, your child's school counselor could assist you in that. And also you're within the community. Sometimes your stakeholders, your state representatives may have resources. Sometimes you have to go multiple places instead of just one place when you feel stuck. Also, modeling good behaviors for your child. A lot of times children come from very chaotic environments, living environments. That's why the school sometimes is a safe haven for many of our children. It's where they get support. It's where they get structure. It's where sometimes they even get food. So, or also parents, model good behaviors for your children. It's a frustrating time and a very challenging time. But when your children see that you're positive and you're supportive, that can definitely help. It may not, handle or answer all the questions or things that are happening, but when your children see you on a positive notion, it helps them in some kind of way. Expressing that you are their support. Having conversations with your children is key, even when they're very young. Just expressing to them that you love them, that you care, and whatever it is that's going on, you're going to get them help. You're going to find them some support, or asking them, who in your school do you talk to? Which one of your teachers do you like, that you feel comfortable? Asking questions. When you don't get those answers, then that is probably the time that you should reach out to your child's school for some support. If you do have a very supportive primary care where your child attends, is extremely helpful. I do know that CHOP has a very, very good program where they realize that mental health is a part of your health. It's just not your physical health. Your mental health is a part of your health. And I was so excited when I learned that mental health was added into physical health, because I always thought that as a clinical therapist, how are we talking about wellness and we're not talking about our mental health? So there are therapists on site at CHOP for therapeutic services. Having open discussions on how your child is feeling. Just having simple conversations of asking your child, how was your day at school? What happened at school today? Just see what type of feedback you can receive from them. Avoid judging, making statements like, you're acting really strange. You don't listen. I just don't get you. I don't understand you. Just saying things negatively, that's just going to tear them down even more. Parents seek support from someone you trust. We need help. We need support as parents. Like I said, it's a difficult time, and it's a reality for a lot of us that our children are struggling, and it may be mental health. Mental health should not be a stigma. It's not a bad word. It is a part of our lives sometimes. Give verbal positive alternatives. Maybe giving positive praise to your children when you see a change in behaviors. If maybe they do have a good day, just saying, you're really doing good today. Sometimes that verbal feedback from you is what they need. Increase positive praise when you see changes in behavior. Like I said, encourage your child. I know for me being a parent, and I'm just going to be open a little bit, during the pandemic, I did have COVID myself in the very beginning of COVID. And it was not good. They didn't know if I was going to live. And that was a time where my daughter and I that was the first time we had ever been separated. Well, I ended up being in the hospital for an entire month. And then following that, I then had to go to rehab. So what my daughter knew as a very structured life and day to day was totally interrupted with no warning. So it affected her a lot. And so the things that I'm sharing with you, I saw in my own daughter, a rapid decline. I'm talking about a straight A student, loves sports. She's a dancer. And I noticed some of those symptoms and signs that we went over, the increased sleeping, the lack of interaction with me, which was, it just really threw me for a loop. I could not handle it, and I just felt like as a therapist, it's something that I did over the years that I love to do because I loved helping families. But now that it was affecting my child, what do? I was stuck. So also, family members may confer with their child's primary care doctor to seek mental health services. Like I said, there are therapeutic services that are offered through a lot of primary care doctors and social workers on site, that if you need support seeking mental health services and behavioral health services through agencies, they have that connection there, because I was overwhelmed with trying to seek whatever supports that my daughter needed. As a clinical therapist, I do that very often. And, at this point, I had to come to the realization, I need support. I can't do it. At that point, it was like, I need, outside resources and individuals to help me. So never be afraid to ask. Reach out to your primary care doctor, reach out to your community stakeholders. They can help you. Even going to your local hospital and asking for support. Once a child with depression is receiving treatment, family members can promote good mental health and encourage them, like having healthy lifestyles. Maybe talk to your child about changing your diet, increasing your eating habits, exercising together, doing more increased and positive things. It also helped my daughter and I kind of come back together, so then I can understand what it is that she needed. So she liked to meditate. I'm not someone that meditates. So those are things that we shared together that, it opened up a conversation to allow her to express how she was feeling and what it was she was needing. Sleeping was a big symptom and factor with my daughter in encouraging her to get up each day and go to school and be motivated. Exercising, that's another important, just maybe taking walks. Walks with your children are good because it opens up conversations. Something else that is helpful is going maybe to your favorite place to eat, just one-to-one time, so that the child doesn't feel pressured. They feel supported and not forced. Also, doing research, things on mood swings. What are other positive impacts? How can you reach out to family members? I know it's a very sometimes closed conversations and you don't want to involve others like family members, maybe close friends, but you will need the support. So reaching out to those individuals that can provide support. Parents and loved ones can also be helpful to depressed children by discouraging them from doing risky behaviors, hanging out with the wrong crowd, excessive chats on the internet. That can be a trigger for especially teens, teaching and talking, having conversations about how to handle things. You definitely want to watch out for that. Pay attention to what your children are researching online, chat rooms that they're involved in. There you may, and this is more so, like I said, in teens, an increase in cutting behavior, a lot of self-image issues and challenges that will just initiate a whole lot of downward spiral type of behaviors.
Shelley, we have a great question for you.
Yes.
How would one differentiate between typical or not uncommon teenager behavior and identifying symptoms of depression?
So in teenagers, It can be challenging because either you'll have a teenager that was like once outgoing, heavily involved in sports or activities, very social, but then over time, you would definitely see a decrease. Maybe teens will typically kind of just stop all types of activities and not want to go out at all. They're more so prone to shutting down and shutting people out. But sometimes it's challenging to differentiate because you have some teens that are introverts by nature. They just like being alone, and they will explain to you, I just like being by myself. I'm more comfortable. I'm more at peace. I would definitely say to look out for just a lack of interaction with others. It usually starts with being social with others in teenagers. Definitely increased sleeping and a lack of hygiene. That's what you'll see the most in teens a lot of times, in my experience as a clinical therapist. Was there another question, Kelly? Okay. So school involvement, it takes a village. School, and I want to say my experience at Hicken and Hicken Middle School and the high school has been extremely a joy to see as a parent and as a clinical professional. I love how the high school in particular has an array of resources in one building. So the students that I've worked with, I've never seen so much support in one building. And it feels really good as a parent to know that those support services are there and they are willing to help. So students not only have one program or one individual they can go to, there's multiple, and they are aware who those professionals and individuals are in the building. That is important. So when a parent is feeling like I need to be involved, I need to talk to someone about receiving help for my child, definitely you want to communicate with your child's teachers, especially if there's a decline in grades. That's where you will mainly see a shift in behaviors. There's something wrong. A child that may have had straight A's, but now are at D's and F's every report. There is an issue there. Sometimes the issue is bigger than what we can see on the surface. So you want to communicate with teachers. Parents could also become involved in monthly meetings like we're doing now. I think this is extremely important and it should continue so that parents can, maybe that may not be the most comfortable with asking questions, but just maybe hear maybe other parents express what they're going through, or just get resources or know what resources and programs are offered at their child's school. And then after they attend a meeting, they may feel more comfortable and more confident in reaching out to a school professional for their child. Reaching out to the counselor. Counselors are key. They are key in providing support for children. They have resources. Hicken, I know, has a resource counselor. And these are things that weren't available to me when I was in school. There's usually one counselor to maybe 1,500 kids. So my daughter attends school in the city. We live in the city in Philadelphia. And, you know, it's no secret that schools in Philadelphia lack resources. When your child has those resources, please use them. Please use them. It will definitely ease some of the tension and frustration and doubt that you have as a parent. You can also request a school assessment. If you see an escalation in your child's behaviors and a decline, regression, aggression, you may want to request a school assessment. So that assessment can go far. I can also tell you, when you do go to your primary care, the primary care psychiatrist or psychologist will excuse me, I need some water, will request an assessment for your child. And that usually is completed by at least 2 teachers that they would like to see. Also, attend parent-teacher conferences, start a conversation with individuals in the building in your child's school. Know who your professionals that are working with your children day to day are. They can definitely provide support. Become involved in the school, maybe join a parent group, maybe volunteer. That will allow you to network and get to know professionals that are helping your child each day. Request resources that may be within your community. There are a lot of good resources in schools. A lot of times there are a lot of programs, like I said, that are offered in school, and there's a lot of resources within a community that just may not be shared, or you may not be aware of and know because you're not involved. So involvement is key. Build positive school relationships. Believe me, I have interacted with a lot of parents that are frustrated to the point where everyone is to blame. There's no way you can help my child. I have parents tell me that my child's not going to talk to you. They don't talk to anyone, but I'm the only person that the child is talking to. So you want to build positive relationships. Yes, it's very frustrating because you don't know what to do. It can feel like you're at a loss for seeking help for your child. And depression, when to watch a child go through a depression, it can also send you into, a very depressed mood. No one wants their child to, experience those things, but children, sometimes it doesn't just, come later on in life. It just happens maybe from a traumatic event. It can happen from the home environment. There's been an increase in violence in the city. It's just what it's called life. Although there could be issues and different factors and triggers that can contribute to it all. It is life. And sometimes it takes over the best of our children. Also, ask questions for things that you don't know about mental health. Definitely ask questions. It's extremely important to ask questions. Don't assume. You want to speak to your professionals, like your child's doctor. Definitely a professional that's skilled in the area. Definitely don't assume. And follow up. Make sure you follow up. If you speak to a teacher or if you speak to a counselor about receiving resources, you want to follow up. You want to make sure that you get those resources, get the information, go back to your child's teacher. If you talk to the teacher about your child receiving tutoring, make sure that you follow up and make sure that your child, receives the tutoring. Or you may need to ask something more serious, how to get your child tested. You may think that they have more special needs. You definitely want to follow up.
Shelley, a question that we have is the school assessment with regards to the student's mental health or just a scholastic performance?
Well, for me, working with Aldersgate for the SAP program, an assessment that will determine if your child shows symptoms of a mental health disorder, and then they will be recommended for whatever services, based on the assessment, what the services that are needed. That could be following up with the primary care or referring them to an agency for therapeutic services, or it could be just needing support in school. So it will depend on what that assessment shows. And that assessment sometimes can be done at school, but they can also be referred out to an agency to receive that assessment as well. So therapy and treatment. Is this a commitment? Yes, it is a true commitment. If it is determined that your child is suffering from clinical depression, a care professional likely will recommend treatment. So treatment could consist of going to an agency for clinical therapy, and that usually is recommended on a weekly basis. Sometimes that will also include the parent. Some therapists, it depends on their discretion. Sometimes they like to include parents in sessions. However, sometimes parents can be a trigger, and that could be from trauma. It could be from a number of things. So a therapist would make that determination. So, and what type of treatment that child may need. Other aspects of treatment may include supportive therapy, like play therapy for children that have been significantly abused. Play therapy allows for children to act out what may have happened to them. So that's definitely good. Behavior therapy or cognitive therapy, that's kind of processing maybe some trauma that may have occurred, or just their feelings in day-to-day life and functioning for behavior therapy. So it just depends. And that will also come from the assessment. When it comes to therapy, an assessment is always going to determine what that child or that family may need. Also weekly sessions. However, in therapy, it is recommended that a child goes to therapy at least once a week for an hour. I was also an outpatient therapist, so definitely once a week for an hour is always helpful. Parents should be a part of the treatment, being consistent, making sure that child goes every week for that hour is definitely essential. Because at some point, also when you seek treatment as well, there's a psychologist and a psychiatrist on board. A psychiatrist may have a conversation with a parent about medication. Medications are given out to children as young as 4 years old. I've also, as an outpatient therapist, I work closely with psychiatrists. Some will decline it and others will prescribe medication. Depends on the child's functioning. Some children cannot function without medication treatment along with therapy. Ask questions, parents ask questions about medications, ask questions when mental health, the symptoms and behaviors, they don't make sense to you, they aren't clear. Please speak with your therapist, your psychologist, and your psychiatrist. Anyone that is involved in that child's treatment, you definitely want to speak to that professional. Discuss your concerns. If your child, if the behaviors are rapidly declining, you definitely want to speak to maybe a psychiatrist at that point about alternative options. Some behavioral health and mental health symptoms can be treated through therapy, but others cannot. Ask about alternative options that would include medication, that may include an alternative school setting. There's something called a partial day program that provides intensive therapeutic behavioral treatment within a school setting, but they also will receive therapeutic services while attending school. It can be short-term, it can also be long-term. And parents, be consistent. Once you have set your child up to receive therapy, Please be consistent. Please go every week or every 2 weeks, even if it's monthly, whenever it's scheduled. Please, therapy is extremely important for children with depression and mental health disorders. It's a part of their development. It's a part of how they become good adults. If it goes untreated, it can definitely worsen over time into adulthood. Some things, some more significant behaviors and mental illnesses such as bipolar, extreme severe anxiety can all develop over time if untreated. So you definitely want to be consistent. Prevention and intervention. There is hope and brighter days coming. So it seems like a lot of darkness when you talk about mental health sometimes, but the truth of the matter is, in any type of traumatic experience, we all want to be loved. We all want to feel supported. So there's definitely hope. There's definitely help. You just have to know how to navigate through it, and you need a support system while you're doing it. So for children from infancy through teenage years, strong, healthy parent-child attachment can help protect the child from developing depression. So like I said, it starts in the womb. Connect with your children at a very early, young age. Children, even at the age of 12 months and older, they feel things. They know love. They know what it feels like to be cared for, but they also know danger, and they also know trauma. So it's extremely important to develop those relationships early. Parental involvement, consistent love and care, as well as attentive responsiveness to a child's needs at all ages and stages of life is important, and it helps them to become independent as well. Preventing depression in childhood tends to involve addressing risk factors. So in smaller children, when those tantrums become increasingly often, you want to pay attention. It doesn't go away. You want to pay attention to those behaviors. Both specific and non-specific strengthening and other protective factors, and using an appropriate approach for a child's development level. So a child that maybe is 5 years old will need your help and support. They shouldn't be dressing them. So I've seen children 5 years old be treated and talked to like adults. So you want to interact and engage with your children at their level. If they are babies and their children, teach them as such. Make sure those relationships are clear for babies. Also, more prevention and intervention programs, like we spoke about. Therapy is very important as a family. Even being involved in your child's treatment is extremely important. It shows that you care. It shows that you want them to feel better. And if they know that you feel good, they are going to feel good. It helps a lot. It may take a while, but it definitely helps. Protective factors for adolescent depression include involving supportive adults. That's in your school, that's in your family, that's in your community. Strong family and peer relationships, healthy coping skills, and emotional regulation. One of the most important things that a parent can do is model for your children. They look up to us. They do, and they want to know, Mom, I'm struggling. Dad, I'm struggling. How can you help me? They want to know that. They want to feel that. Children of a depressed parent tend to be more resilient when the child is more able to focus on age-appropriate tasks in their lives and their relationships, as well as being able to understand their parents' conditions. So children also know and feed off of how we're feeling as adults. They watch us. They know when something is wrong. So having conversations with your child, I'm not feeling well today. But I am going to try to explaining to them how you feel. It will get them to maybe open up and telling you how they feel. Having realistic conversations for age appropriate children, even small children. Mommy, daddy doesn't feel good today. I didn't have a good day, so it's making me feel a little sad. Expressing how you feel and maybe why within age appropriate limits. For depressed parents, their children seem to be less likely to develop, it should say depressive moods. So depressed parents, if you engage with your children, because some of us have our own challenges, so still engaging and interacting with your children as much as you can and communicating with them. Also, the last bullet just talks about commitment. You want to commit and want to be consistent. That's also key. Okay, so I have more prevention and no, I think. Okay, here we go. So something that I just learned about that I couldn't wait to share with everyone. So this slide talks about insurance and paying for treatment. I am out of network. I don't know what happened during the pandemic, but my health insurance and seeking therapy and going through and overcoming COVID, I definitely wanted to seek some supportive services for myself and for my daughter. I was told, I don't know how many times you're out of network. The expense for therapy is outrageous. However, I did not know that CVS offers behavioral health services. However, I don't know in detail what that may be. I don't know if they provide therapy. I'm not sure, but I do know that CVS offers behavioral health services. So you may want to do some research or maybe visit a CVS to find out what services they do provide. I know I will, because I love sharing resources with my families that I work with and just with my friends and family in general. So definitely check CVS out, especially for those parents children that are maybe on a wait list for therapy across the board in the city of Philadelphia, in Montgomery County, Bucks County. There could be a wait list for a week of your child receiving or coming in for intakes, or it could be up to 6 months. So it's pretty backed up right now. So services such as CVS that offers therapeutic services, you definitely want to check out what they do offer. Contact your family doctor. A lot of families are not aware that there are therapists on site. In particular, CHOP, I know that there is a therapist on site at the satellite offices to provide therapeutic services for children. Also, request affordable payment plan. Your average intake, if you have to pay out of pocket for services, the average intake for therapy services for children starts at $150. Sessions can start anywhere from $180 all the way up to $300 per session. So when I said as a therapist, maybe have your child in therapy weekly, well, not at those costs. It's extremely expensive. However, make sure you discuss with your agency that you may be interested in seeking therapy for your child. Do they have payment plans? If you have to pay out of pocket, are they willing to work with you as far as a payment plan? If you don't ask, you won't know. I never knew that they would do that. So that's definitely something that you want to do. Or ask for community resources. A lot of times in the community, there are free services that we don't know about. In your local libraries, there are different activities. There are also groups, children, in particular teens, or maybe 12 years old up to 18. There are groups for students after school to have some of these types of discussions around depressive moods, anxiety, just in your local library. So you have to get out there and sometimes just do research. Here are some list of resources. I want to be able to share this with everyone. Kelly, could you assist me in that?
Absolutely. So the this presentation will also is videotaped, and we'll have it on our resource page. And I can
Okay.
also take this page and also add it on as a separate document to our resource page.
Okay, in the
Thank you.
chat, I also would like to provide my information if parents would like to follow up with me. I definitely would like to encourage that you do so. If you want to have a further conversation, I definitely encourage you to reach out to me. Self-care, self-care, self-care. I cannot say that enough. No, you are not alone, parents. You can't do it alone. You can't. I can say that. I don't like to say what's definite, but you can't do it alone. I thought I could do it alone. When it was a reality for me that, my daughter needed help and support, I did not want to share that with anyone. So self-care is extremely important. And through you getting support for your child, should not be frowned upon. You should not blame yourself. You should do whatever is necessary to help your child and help your family be safe, feel safe, and you will get through this. You definitely will, but it definitely takes a supportive system. I can say that with confidence. It definitely takes a system in support. So parents, please take care of your own mental health. Some things are genetic. Some things run in our genes that are out of our control. So you definitely want to be in contact with professionals surrounding mental health when you don't feel yourself as well, or if you're struggling with mental health. Increase learning about mental health. Educate yourself more about mental health and what that is and what that looks like. Find support in others. Support system is definitely needed. Also, find out what's available to you, that again, within your community, through your primary care, through your local hospitals, and like we said, CVS, find out what's available to you. Also reach out to stakeholders in the community, your local, I'm thinking of senators, but your local district lawmakers and things of that nature. Reach out to your stakeholders in the community. Also, start your own parent workshop or blog. Sometimes when you don't have the answers, you can invite other parents in that may be having the same experience or may have gone through the process, and you can begin to share, and it opens up a much bigger conversation. Talk to your children. Stop yelling, parents. I'm a yeller. So this is my own advice. Don't yell when you don't understand. When you start to see your children decline, it is a cry for help. It is saying, I need you. I am not strong. Mom, I am not strong. Dad, I need you. Stop yelling. Kids do not respond to yelling. They don't. I had to learn that the hard way. But once you understand, it gets better. That's why I'm able to have this conversation openly with you, and I feel really good about it. Parents, know when you're not okay. It's not okay. I don't feel good. My child needs help. I don't know what to do. It is okay not to be okay, but do something about it. It is okay not to be okay, but it's not okay to stay there. it will not go away. Your kids need you and you need you. So that is important. And that is my last comment for today. Please, self-care, it's important. It's a phrase, but very important phrase. And thank you. Thank you. Change begins with you, begins with me, it begins with all of us. And I wish all of you the best. And I hope we do this again.
Shelley, we have
Very
another
good.
question for you.
Okay.
If a teenager suffers from signs of depression,
Mhm.
then it is not inconceivable that the person is not willing to seek support or assessment. What are good strategies to convince a teenager to actually seek help?
You definitely want to start by asking simply why. Why don't you want to talk to someone? This happens a lot, especially in teenagers. I would definitely not force the conversation. Maybe you just aren't the person that should approach the situation. Then that's when I would possibly reach out to someone at the school,
Professional.
possibly like the counselor, or find out who that child is most comfortable with, maybe at the school. Sometimes parents, we can't do it because we're trying to be a parent. We want to know why. Why won't you talk to someone? If we become aggressive. So find out who that child is connected to, and then kind of use them to help support you and reaching that student. I have a lot of students say no, and then once they start to come to see me, they never stop. So I have some questions in the chat.
I had asked all the questions in the chat.
Yeah, okay, good.
But are there any other questions I believe you can unmute yourself and ask a question if you have one. Shelley, could you just take a minute or two and just explain to us what a SAP assessment is, a student assistance program assessment for when students are seeking some mental health through the school district, and we offer them a SAP assessment?
So a SAP assessment will identify that there is a need, that there is a decline in a student's behavior. Usually it could work both ways. Either a parent may reach out to the counselor, or a counselor may reach out to a parent and express just some behavioral concerns. A lot of times when a SAP assessment is done, the behaviors are pretty extreme. Avoiding coming to school, increased in suspensions, aggression, very depressed mood, maybe cutting class, just kind of like disappearing in the building, in the bathroom for hours from anxiety. So those are your more serious behaviors. So at that point, a SAP assessment would be recommended. And then, like I said, working with Aldersgate, then we will refer that family to go into the agency and have an assessment with the clinical director. At that point, the clinical director will review the behaviors with the parent and the child, and then recommend what is needed following that assessment, or following what was described in the meeting or assessment meeting with the clinical director. So that could be, like I said, outside therapy. It could be meeting with the SAT liaison if available at the school for school support, or a higher level of need. But then after that family is recommended for service, they will identify if an agency needs to be contacted, those types of things. they'll definitely identify what the behaviors are and what's needed to follow up.
So the next question is, does Wissahickon High School offer a SAP assessment, and who do you contact? So when we offer SAP assessments, we offer them through Aldersgate. So if you have a concern, you can reach out to your guidance counselor. We do offer SAP assessments through Aldersgate K-12, so it's not just the high school. And any school counselor you can contact, and they will be able to help you work through the process. And or you can just contact Aldersgate yourself as a parent.
I can put put my information in the chat.
So I just wanted to follow up too, before we say thank you, that, Wissahickon School District does offer school counseling services. We do offer Aldersgate services in all the buildings K-12. And we do have some other mental health supports that we offer through the school district. So if anytime that you have a concern, please reach out either to the Student Services Department, or you can reach out to the school counselor, or you can reach out to your school psychologist. They would be able to help you navigate the process. One last item, is the presentation being made available on the Wissahickon website? Yes, it will be. Tomorrow it will be up on the website. I just want to remind everybody that next week, next Wednesday, we also have another presentation, and that presentation is Building Self-Esteem in Children. And that will be, the presenter will be Lauren Sharpella, who is also from Aldersgate. So we hope you can join us next week. Shelley, was a very informative presentation for me as a professional, as well as a parent as well of teenagers. So thank you very much.
Thank you.
And we appreciate you spending your night with us. Thank you.
That's true.
I provided my email for my Wissahickon email. Anyone that would like to follow up. And thank you. I hope we can do this again.
So much again, and have a good night. This was very informative. Thank you.
Absolutely.
night,
Thank
everyone.
you.
Thank you for
Bye.
everybody logging on.
Thank you.
Thank you.
Are we okay to end? Should I stick around for a few minutes?
No, I just, want to say thank you very much for taking the time and doing all this. This is wonderful. Hopefully in the near future, we'll have some follow-up sessions.
Yes.
I appreciate it. Thank you so much, Shelley. You did a great job.
Thank you. Have a good evening.
Do you know how to end it?
Yeah, I see end that as
Okay.
an option, so that's easy.
Thank you so much.
Thank you. Talk to you soon.